Good afternoon, everyone. Welcome to our webinar titled Social Policies in Atlantic Canada, Links to Children's Fall Prevention, facilitated by the Fall Prevention Community of Practice. My name is Shamiza, and I'm the Knowledge Coordinator at the Ontario Neurotrauma Foundation, also known as ONF. ONF sponsors the Fall Prevention Communities of Practice Loop and Loop Junior, along with the annual Fall Prevention Month campaign. So, like always, before we begin, I'd like to give a quick rundown of the Zoom meeting platform. So your screen may look a little bit different depending on the type of computer that you are using. If your Zoom application is opened in full screen, you can double click or press the escape button on your keyboard to exit full screen. You can also click the exit full screen button in the top right corner of your screen. And the webinar technology consists of two parts, which are audio and visual, and both are provided through your computer monitor and speakers. To test or adjust your audio settings, look for the audio settings or join audio button in the bottom left corner of your screen. And this will provide options for testing your computer microphone and speakers. And for this webinar, though, all participants will be muted. Now, if you look to the bottom center of your screen, you'll see buttons that will allow you to access the chat box, raise hand feature, and Q&A feature on Zoom. The chat box will allow you to send messages to the webinar participants and presenters, along with other webinar participants. You can use the raise hand button if you want me to connect with you through the chat box, or you can submit Q&As or your questions through the Q&A box, which will be answered at the end of the webinar. So to simplify things a little bit, for technical questions such as I can't hear the presenters, please use the chat box. And for any topic related questions pertaining to the actual webinar, please use the Q&A box. And if you need to leave the webinar at any point in time, click the red leave meeting button in the bottom right corner of your screen. So if you have a question about the technology at any point in time during the presentation, please type them into the chat box. My colleague Marguerite and I will be monitoring this. You can also email me at shamiza.allard@onf.org, and I'll work with you to resolve any of your technical issues. So the webinar is being recorded, and a YouTube link will be sent to all participants in about a week, along with the presentation slides. Just going back to this page. So to view previous webinar recordings, head over to the webinar page on Loop Junior and click Archived Webinars, and this will allow you to see all of the archived webinars. So I'd like to now introduce our presenters, Chantal Walsh and Jennifer Russell. Chantal is a health promotion specialist with the Child Safety Link program at the IWK Health Center. Jennifer is the executive director for the Atlantic Collaborative on Injury Prevention. For a complete bio of Jennifer and Chantal, please view the Zoom webinar invitation. So now, without further ado, please take it away, Chantal and Jennifer. Jennifer, you may now share your screen.
Excellent. Thank you, Shamiza, and welcome everyone. Thank you for joining us on today's webinar, and we hope you look forward to what we have to discuss today. As Shamiza mentioned, my name is Jennifer and my colleague Chantal Walsh will both be presenting today. And the focus of our presentation will be on a report that we are releasing this week in our efforts during Fall Prevention Month. And the report is Social Policies in Atlantic Canada, Links to Children's Fall Prevention. We get Chantal to change slides.
Sorry, I'm not sure what is happening here. There.
There we go.
Technology.
Thank you. Shamiza did give a little bit of a brief bio for us. And I did want to just highlight our organization's websites where you can find more information about the work that we do. The Atlantic Collaborative on Injury Prevention, or ACIP for short, and Child Safety Link do focus on injuries across both the Maritimes and Atlantic Canada. ACIP focuses more on all ages, whereas Child Safety Link does focus on children ages 14 and under. And we do work closely as organizations together. We've done a lot of collaborative work and projects, which we will speak to today. Next slide, please. So we have developed a series of presentations just based on the work that we've been doing around social policy and fall prevention. So we have collaborated on several pieces of work, and each presentation highlights sort of a progression of the work that we've done. The first presentation occurred in 2019, which was done through Loop as well. And that's where we introduced the links between the social determinants of health, fall prevention, and social policy. So our initial exploration with those topics, with a focus on older adults at the time, and a little bit of an introduction into children and youth. At this point in time, there was only one report available, and that report focused on fall prevention among older adults using a social policy lens. And today we're looking at a similar report that we developed, but this time it has a specific focus on children's fall prevention. And then in the near future, another presentation in this series will look at being an influencer for social policy using an injury prevention perspective. And through that presentation, which we will also be hosting on Loop, we'll have lots of examples of stakeholder activities of how to influence different aspects of social policy. And I believe that will occur in February of 2021. So hopefully you'll join us again for that one. And next slide. So we do have 2 poll questions, and we'll get Shamiza to launch those for us. So we'll just get you to fill these out. This is really just to give us a sense of who's participating today and how we might better be able to use this information in our work moving forward. Okay, so looks like we have quite a variation, which is good. And the next one, which is about the sector that you work in. So lots of public health on the webinar today, which is great. Thanks, Shamiza, for launching those for us. So we'll move right along. So what you can expect from our presentation today, we'll provide an introduction and maybe a refresh for some of you participants on today's webinar on the links between fall prevention, the social determinants of health, and social policy, which does include some data, some definitions, and some examples. We'll provide a bit of a background and context to how we developed the report. And then we'll spend some time highlighting certain elements of the report, including specific examples of social policies and the links between social determinants of health and children's fall prevention by each Atlantic province. And then, as Shamiza mentioned, we'll save questions for the end, but do feel free to enter those into the Q&A as we go through the presentation. And I'll pass it along to Chantel now.
There's a little bit of a delay when I go to switch the slide, so my apologies. A moment here. Isn't technology fun? Yeah, I can't seem to. There we go. Now it's probably going to go about 4 slides ahead because I've pushed it 4 times. So yes, Jen had mentioned that we will touch a bit on refresh of fall prevention, social determinants of health, social policy, and the links between these. So among children and youth 0 to 14 years, fall-related injuries are the #1 cause of injury, hospitalization, in Canada. In 2010, over 7,000 children and youth aged 0 to 14 years were admitted to a hospital, and we have seen over 150,000 children visiting an emergency department as a result of a fall. Falls in children of that age cost an estimated $1.2 billion. Certainly a issue in our country. So social determinants of health and injury, it's safe to say that we do know injury does not affect all people equally, and the conditions in which we work, live, and play are the social determinants of health as a whole. Why is this important? Well, the burden of injury is not shared equally among the population, as I mentioned. The primary factors that shape health, including our ability to prevent injuries, are not lifestyle choices or medical treatments, but rather the conditions in which we live, work, and play. Our health is shaped by how income and wealth is distributed, by the health and social services we receive, and our ability to obtain quality food, education, and housing, as well as many other factors that do exist. ACIP has reported as a report titled The Social Determinants of Injury and is available on our website under the library section for folks who might be interested in reaccessing that. And if anyone is interested in learning more about the connections between the social determinants of health and injury, it's a great report to revisit and just to familiarize yourselves with. Just some examples of social determinants of health. It's always nice to revisit those. We have income, socioeconomic status, education and literacy. There's employment, early childhood, child development, physical environment. Then we also see social supports, coping skills, access to health services. There's a wealth of social determinants of health that do exist. And in looking at a specific example of how the social determinants of health and fall prevention link together or may link together, we have pulled out the issue of income. So looking at folks or in cases where lower income is an issue, what may be experienced by this particular environment would be, and different areas that are affected would be working conditions, living conditions, and also environments such as play environments. Therefore, increasing or leading to potentially negative exposures, increases among fall-related risk, and therefore an increased risk for injury. So in getting a little closer to the social policy link, social policy initiatives can reduce injuries by improving social and economic conditions, as well as enabling individuals to increase control over and improve various aspects of their health. A little more specifically, looking at what social policy involves and what it is, in fact, is a range of benefits or programs and supports that protect citizens through various life changes that can affect their health. Social policy functions as a social safety net to ensure that people are not negatively impacted by these life changes, whether they're positive or negative changes. And social policy considers the different roles of society, governments, communities, individuals, and other agencies in providing support and services across the lifespan. So not just limiting to one age group, but also including across the lifespan. A few examples of social policy. There's certainly not an exhaustive list here, but a few examples that we've included for today's purposes include family allowances, childcare, employment insurance, health and social services, social assistance, disability benefits, home care, and retirement pensions. And so by revisiting the issue, the social determinant of health issue of income, and applying a social policy lens or applying a social policy approach to that, revisiting the example would be looking at income, understanding that it doesn't automatically lead to, or these factors are not reliant on one another specifically, but a lower income with poor living conditions, if a social policy of a child benefit, for example, was introduced to remedy that in some way, it can certainly have effects that would improve, although maybe not necessarily decrease the chance or the risk of injury. It can certainly improve overall living conditions, decreased negative exposures could then result from that, and overall a decreased risk for injury could be something that would occur.
All right, and to give you again some background and context to the work we've done around these topic areas and the links. So in 2019, ACIP did develop a report titled Fall Prevention Among Seniors and the Social Determinants of Health, the Social Policy Lens. This report provides a background on fall-related injuries among older adults, again, highlights those links that we've outlined in those previous slides, specifically around fall prevention among older adults. It discusses activities that seek to address the social determinants of health in preventing falls, and then highlights current fall prevention initiatives by Atlantic Province and examples of social policies that could enhance or complement fall prevention efforts. Our objective with this report, and certainly with the report that we'll introduce to you soon around children's fall prevention, is really to use existing pieces to build an introductory information base of significant social policy links between the social determinants of health and fall prevention, so that current and future interventions could take these links into consideration. So our goal is really not to provide a sense of or prescriptive action, but rather just bring awareness to this lens that could be used to help fall prevention efforts moving forward. So ACIP developed that report in 2019. And then next slide, please. From there, we collaborated with Child Safety Link to expand some of this thinking to be across the lifespan. And this was our initial scope or exploration of this with Child Safety Link. So we hosted a webinar over a year ago now, which seems crazy that was a year ago. And the goal of the webinar was really, again, to introduce this lens to stakeholders, to think beyond just some of the individual interventions related to fall prevention. So just introduce and bring awareness to another way of thinking, and encourage the use of multiple strategies in order to achieve the highest degree of effectiveness. And so we did have really high participation for that webinar, which was great to see. Lots of great discussion, both at the webinar and then also in some of the discussion forums on Loop. And next slide, please. From there, we had a lot of follow-up questions and a lot of follow-up sort of ideas for next steps. And one of them being a follow-up survey. We wanted to really hone in on some of the barriers and challenges to working with social policy or addressing the social terms of health, all related to fall prevention, and what the possible solutions would be to addressing these barriers. So understanding that this way of thinking and this lens may be new for a lot of people, and just wanting to support working through that as best as we could. So we didn't receive too many responses. We received about 15. Those that did fill out the survey provided a lot of feedback and information to the questions, which was really helpful. And so part of that was to focus or to provide a similar framework for children's fall prevention that we did for seniors and older adults. So really providing specific examples that could really highlight the links that we were discussing. And I'll get you to change to the next slide, which brings us to the report that we would like to share with you today. And that is an environmental scan document, again, that looks at social policies in Atlantic Canada and the links to children's fall prevention. Get you to switch to next slide. And similar to the report with seniors fall prevention, the purpose of this document is to provide social policy examples by province to really show those examples, and then to demonstrate the links that these social policies have to the social determinants of health and fall prevention among children. And I just want to point out that we know that social policy is just one component that can influence or have influence on fall prevention, and we are mindful that a comprehensive approach with many different strategies and activities working together will have the most positive impact on preventing fall-related injuries. And we just want to make note that our goal is to raise awareness to this way of thinking, or this lens, the social policy lens. So that doesn't mean that all policies and related activities will be implemented and in how we describe them through the webinar today. So for example, we'll discuss the role of social policies that provide some sort of financial aid or assistance, and the link that could have for families to then be able to afford to purchase safety equipment. So we understand that the providing financial assistance in that form doesn't automatically mean that a family will use that money to purchase safety equipment, but as stakeholders, we can help raise awareness to these opportunities and also work with families to ensure that their basic needs are being met that allow for safety interventions to take place. So we just want to make that important note moving forward as we share some of the examples that we highlight in the report.
Thanks, Jen. Once again, just trying to get this to move over so that we can chat about some of these examples. Okay, there we go. Thank you. There. So as Jen had mentioned, we did pull out some of the examples that by province that are used and can be used or could be used to influence social policy examples or social policy work that we would do or could do. So one being within Nova Scotia, one being the Nova Scotia Child Benefit is a monthly financial benefit paid to low-income families with children. And it's linked to social determinants of health and fall prevention in that it provides financial assistance to lower income families with children. This money could then be put towards items such as safety equipment, which may in turn help prevent falls in the home. And its partnership and sector that it's involved with is Department of Community Services, as well as the Child Benefit Program through Canada Revenue Agency. Secondly, second example, Parenting Journey is a home visitation program that provides support to families to help with child well-being and development, parenting, family life management, community connectedness, linkage, and referrals. It's links to social determinants of health and fall prevention in that it works collaboratively with families to build meaningful, helping relationships while collectively identifying strengths, resources, and priorities to address challenges among child development, which includes fall prevention, rather. A few more examples to highlight. The Child Care Subsidy through the Department of Education and Early Childhood Development is a financial benefit available to eligible families to help with the cost of licensed daycare. And its links to social determinants of health and fall prevention are that it helps parents with the cost of daycare and ensures parents are sending their children to facilities which adhere to the Daycare Act and regulations. Finally, the home ownership preservation, as an example that we want to highlight through Housing Nova Scotia, is a program available to individuals or families of low income. Funding is available to eligible families in order to make major repairs so that the minimum level of health and safety standards can be met within their individual homes. And links to social policy or social determinants of health and fall prevention. So if eligible, funding can be applied to structural repairs within the home. So for example, stairs, which in turn can help prevent falls in that home. Moving to New Brunswick for a few examples from the province of New Brunswick. Early learning in child Care Services is responsible for licensing and monitoring early learning and child care centers and homes through the Department of Education and Childhood Development. Links to social determinants of health and fall prevention. Early Learning and Child Care Services ensures daycares are adhering to the Early Childhood Services Act and regulations, which include requirements for playground equipment to reduce playground fall injuries. This act recommends playground equipment adhere to the CSA standards, but it is not required. The Family and Youth Capital Assistance Program through Regional Development Corporation is a program providing funding for projects in support of youth and family-related activities, which also include or such as playgrounds. Its links to social determinants of health and fall prevention in that it allows communities to install safe, age-appropriate playground equipment to reduce playground fall injuries. So some nice examples within New Brunswick of some of the playground fall-related risks that we see. The federal and provincial repair program through the Department of Social Development provides financial assistance for low-income homeowners to repair, rehabilitate, or improve substandard housing, or make modifications for occupants with disabilities. And links to the social determinants of health and fall prevention, so allowing families to repair particular hazards in the home to ultimately reduce the risk of fall-related injuries. And Healthy Families, Healthy Babies program through the Department of Health in New Brunswick offers pre- and postnatal services to families. Postnatal services focus on healthy growth and development and can include, but aren't limited to, home visits. Its links to fall prevention. It provides an opportunity to identify hazards in the home and educate parents about preventing falls in the home. So twofold there.
We'll move along to some examples from Newfoundland and Labrador. Most of the provinces had, you'll notice, a social policy around a child benefit. So that providing, not to sort of provide any information or any previous information that Chantel went over, but similar to the other provinces, it does provide some financial assistance, which could be put towards, again, some safety equipment, which would help prevent falls in the home. Reiterating that doesn't automatically mean that that's what families are going to use that benefit for, but certainly the financial assistance does provide support for making sure that the family's basic needs are being met, which could then allow for some fall prevention measures to be implemented. Same for the operating grant program in Newfoundland and Labrador. This subsidizes the cost of licensed childcare centers to make these services more accessible for parents of young children. Again, that helps ensure that, or helps parents with the cost of daycare and ensures they're sending their children to facilities which adhere to the Daycare Act and regulations. So a lot of these, next slide, please. A lot of these social policies, as you see, aren't directly contributing to fall prevention, but certainly there could be some potential influence or indirect contribution to reducing fall-related injuries or the risk for fall-related injuries. So the next one being the provincial home repair program. So again, provides financial assistance to low-income homeowners for repairs to maintain safety of a dwelling. So this allows family to repair hazards in the home, which helps to reduce the hazards related to fall-related injuries. And then parent and child health programs are designed to offer and support service for families pre and postnatal in the areas of growth and development, safety and injury prevention, which provides an opportunity to educate parents about preventing fall-related injuries among other child development areas. And next slide, please. Looking at PEI, we've tried to pull out some social policy services and programs that are unique to the province. Certainly, if you're not within the Atlantic Canada region, some of these programs may be called something different within your province, but certainly a lot of these services are offered in many other jurisdictions or have similar objectives to the ones that we're presenting to you today from Atlantic Canada. So on PEI, the Best Start is a home visit program that provides families with education and support for healthy child development. Again, this provides families with an opportunity to identify hazards in the home, as well as some education about preventing falls in the home. The Triple P Positive Parenting Program is an approach to parenting that gives parents tools and strategies to help manage the big and small problems of family life. And so the links to this are that it provides helpful tips to raise children in an environment that is safe. The Triple P's Positive Parenting Program does not tell parents how to raise their children, but more so how they can establish the rules and boundaries without harm or injury. And then next slide. So lastly, we'll highlight the Family Housing Program on PEI, which provides low-income families on PEI with appropriate housing at a reduced cost. And so the links to social determinants of health and fall prevention for those qualified applicants of the program means they are provided with quality rental housing units for families and individuals with lower income. And that creates the support needed for a safe environment for families, which can help reduce hazards and risks for injuries, including those from falls.
So thank you. That was a great way to look at some comprehensive options available there that exist in each of the Atlantic provinces. It's safe to say that adequate investment into social policy would certainly reduce injury and other health issues across Canada. There is significant interest in addressing fall prevention using a social policy lens based on what we were able to retrieve. Significant evidence to support the use of social policy to address health. And to conclude that there is an opportunity to continue this discussion and further discussions around the topic of social policy through Loop and Loop Junior. Just a couple of images there of the two documents we've been discussing or referenced earlier on in our introduction. So the social policy in Atlantic Canada, the link to children's fall prevention document that we're speaking to, what it looks like, and there will be a link available soon. We just encountered a little glitch with posting that, so that will follow. Information on how you can access that and print a copy for yourselves as well, that will follow. But in the meantime, the Seniors Fall Prevention and Social Determinants of Health Social Policy Lens document is available at the link attached there.
And then as mentioned, coming in the new year, we will be launching a report around being an influencer for social policy. So really getting into specific examples of the role that the different activities and roles that stakeholders can take when it comes to the social policy process. And from that report, we also created an infographic, which is able to communicate some of that information in a more visual way. And then again, the webinar will be in the new year, and that will be posted on Loop as well. So stay tuned for that. And that is the end of our presentation. So I guess we will answer questions now if there are any.
Great. Thank you very much, Jennifer and Chantal, for this wonderful presentation and sharing your extensive knowledge on social policies. So participants, we're encouraging you now to, if you have any questions, do submit them into the Q&A box, and then we'll go ahead and start addressing these. Let's see. You can also type them into the chat box as well, whichever works for you, but let us know if you have any questions. And Jen and Chantal, do you guys have any questions? I know it's a small group, so it's probably a great way to maybe do a little bit of discussions if you have any. Do you have any questions for the participants or any things that you want to know more that they could provide insights to, anything like that? And then we can have a bit of a discussion in the chat box.
Yeah, certainly. I think I have more of a comment, if I may, just to mention that it's great to have the participation that we have today, even though small. It's great to know that this is a topic in an area that is intriguing to folks from across the country, so that there is opportunity there to explore it further within individual provinces, but maybe more so collectively too, moving forward.
Absolutely. So we did have one question from Marguerite stating, what are parents saying about the social determinants of health, etc.?
Thanks, Marguerite, for that question. We haven't engaged or consulted directly with parents on this topic. We've mostly stayed with stakeholders, specifically those who work in fall prevention or have an interest in fall prevention. So I don't think we can speak to parents' perceptions of that, but certainly perhaps in future work, I know Child Safety Link does a little bit more engagement with their community, more so than ACIP does. So Chantal, did you have any thoughts around that?
Yeah, we will, just to speak to the project that we have recently completed, and a report is sort of in the works with just the topic of engagement, more so again with professionals working with families, but we have been able to tap into some of that knowledge base or some of what the main barriers or issues are when it comes to injury prevention among children specifically. So it's nice to have the perspective, or it's great to gather that perspective through the folks who are working with parents. We haven't done specific engagement work with parents directly. Now, some of those people who participated as a partner of ours may also be parents, so can speak in that both of those ways and those manners. But we will have some information coming out that I'm happy to even discuss or share a little bit through Loop, because it certainly will pertain to falls and fall prevention work, based on the questions that we had asked through some of that engagement work. So don't lose your question, Marguerite, by any means, but perhaps some of that information may speak more directly to that audience specifically in the months to come.
Great. And then I know Marguerite's second part of it was, have you interacted with others doing a similar role in other provinces?
So yes, some of the engagement work that we would have just recently completed, we limited just due to funding and other reasons to just Nova Scotia for now, but it's certainly something that within our program at Child Safety Link, we've looked into maybe expanding that a little bit, just based on interest and based on, well, obviously funding is certainly an issue that we all seem to encounter, but it's definitely on our radar.
Excellent. And then Richard has posted a question. Is there, or are there any other programs in Atlantic Canada that encourage an intergenerational approach to fall prevention?
Richard, thanks for joining and posing the question. Just wondering if you could maybe expand on or provide a little bit more context to what you mean by that, in terms of, do you mean a social policy or just general fall prevention programs? In terms, if you're speaking of, okay, both. So I don't know of any current programs through the work that we're doing related to the social policy piece. However, social policies themselves, and many that we've highlighted, can cover many, not just, for example, children's, but many of them cover a wide range of ages, and would help the multiple generational piece. So I don't know of any specifically designed with that approach, but certainly there is some impact, whether indirectly or directly from that. But that's a really good question.
Yeah.
And if there's anyone else, maybe if there is a participant who maybe has a little bit more information or knows a specific program, please do type it out in the Q&A, because I think everyone would be interested in learning more.
Excellent. So now we're going to move on to the next question. Do your stakeholders discuss the concept of less supervised or free range play as opposed to helicopter parenting?
It definitely comes up quite frequently, just the topic of, or the issue of risky play, what language to use, the best approach to it. We certainly as a program have received mixed messaging, or mixed words, mixed messaging as far as what is the appropriate approach or what is the right way to address that particular topic. So it is something we are constantly working on to ensure that we're up to date with the most recent information and research that is out there, that we're sharing that. And then obviously it's an issue that risk in any area of injury prevention within our program does come up often. So it's always something that we are thinking about how to best address and how to convey it in a way that isn't giving that helicopter parenting approach. We call it the be careful culture in a lot of ways. I do see someone had mentioned about linking to the senior paper that we mentioned in the end of our presentation. So Jen has sent along that link in our chat box if folks are interested in just copying that down or clicking on that directly to access that report. And as I mentioned, the second report will come. The link to that will follow very soon, we hope.
And we will include the links on our slides as well when they're shared on Loop. So you'll be able to access the link from those as well.
Great. So we still have a few minutes left. So if anybody wants to add in any additional questions, we'll leave the floor open for just a few minutes. But just with respect to some housekeeping things, as we're doing that, as Jen just recently mentioned, I will be posting the slides and the webinar recording. So this webinar is being recorded and it'll be posted on Loop Junior in a few days. So I usually try to get that done as soon as possible. So if you want to, rewatch the webinar, if you want to share it with any colleagues, that will be available for you to do so. So we're not seeing any additional questions come in, so maybe it will be a good time to wrap up now. But as I'm doing so, feel free to put some more questions in there if you'd like. But in any case, thank you so much, Jennifer, Chantal, for your participation and doing this excellent webinar today. And participants, thank you so much for joining in and engaging with us. So for more information about the fall prevention community of practice, please visit Loop Junior at junior.fallsloop.com. And when the webinar has ended, you'll be redirected to Zoom and invited to participate in just a quick short evaluation survey. You just got to click on the blue continue button and you'll be redirected there. And we'd appreciate any feedback that you can provide with us so we can continue to offer high quality webinars. So that wraps up our presentation. Thank you all.